Hi, this is Dr. Gans again, and welcome to part 4. Today we're going to talk a little bit about dental implants. Now, before we do, we want you once again to take a look at the disclaimer on the first video. That being said, the questions that are typically asked about dental implants, or the problems that typically arise, relate to the first question: my implant is loose, what do I do? The second, my cap or crowns or whatever just came off of my implant. The third is that the denture no longer stays in and I have implants. Why is this happening? And finally, my implants hurt. What do I need to do? So let's answer each of these questions. My implant is loose. What do I do? Well, first, don't worry. Most of the time when an implant restoration appears loose, it's really not the implant that's loose. It's either the crown or the abutment, which is the piece that screws into your implant that holds your crown. It's that piece that may be loose and not the implant itself. However, unfortunately, implants sometimes do get loose themselves. A loose implant, especially one that hurts, can be a sign that the implant may be failing. It's important not to wait to get this fixed. If it is the restoration that's loose and not the implant, by postponing the visit, this may result in fracture of the screws that attach the restoration to your implant. This can cause a significant problem, and it's important that you call your dentist as soon as possible. Now, my cap just came off my implant. What do I do? Well, once again, don't worry. Typically, restorations, caps or crowns, cemented on implants only use temporary cement. So that if the screw holding the abutment, once again, that's the piece that holds the cap onto your implant, if that piece comes loose, by having the crown only temporarily cemented, your dentist can take the crown off, and he can go ahead, tighten that screw, and put the crown back on without having to destroy it. So if that crown does come off, put the crown somewhere safe, don't lose it, call your dentist and get the crown re-cemented. Also, make sure that your dentist checks to make sure that the abutment is screwed down tight. Sometimes they can loosen and need retightening. Now, my denture no longer stays in and I have implants. Is this an emergency? Well, if your implant denture is loose, it's very important for you to see the dentist. It may just be a result of a loose attachment. That's the device that helps hold your denture to the implant, it gives you denture retention, or possibly some other issue relating to the implants themselves. And don't wait. Once again. The longer the denture is loose and moving around, the greater the stress to your implants and the greater danger is to the denture, or even worse, the implants themselves. Give your dentist a call. And finally, my implants hurt. What do I need to do? Well, this is a real important issue to take care of immediately. Implants should not hurt. Now, that being said, it is no cause for panic. The pain you're feeling may be coming from a variety of issues that may not relate to the implant itself or its potential failure. It may just be the gum tissue around the implant, or possibly even your bite. However, that being said, this is no time to wait. You should call your dentist immediately. This is the end of the section on dental implants.